let's begin today's lecture with diabetes, but this time I'll teach you about diabetic insipidus and SIADH, which is the problem with pituitary gland. Do you know some of the hormones secreted by pituitary gland? Any of the hormones which is being secreted by pituitary gland? Anyone?
ADH and thyroid.
Thyroid gland. Okay, so if thyroid is produced by pituitary gland, then thyroid gland will produce what?
T3, T4. No, actually TSH produce this T3, T4.
All right, anyways, one person is correct, ADH, and it secretes oxytocin, which is very helpful during the childbirth and milk production. All right, now let's discuss about the diabetic insipidus. And most of you, the issue is that because its name is diabetic insipidus, we think that it is somehow related with diabetic mellitus. Absolutely no link with insulin at all. Absolutely no relation with insulin. I will ask you that why it is known as diabetic insipidus. Please let me know. I will first of all let me explain what is diabetic insipidus and SIADH. These both diseases are related to the pituitary gland problem and one of the hormones, and they are opposite to each other. You can have paper and pen if you want to, and I will teach you in my best way that what is the easiest way to remember anything. All right. So let's begin with diabetes, insipidus and SIADH. So what is this issue? Just give me a second. All right, recording is on. All right. So these issues, it is related with one of the hormones called ADH. ADH means antidiuretic hormone. What is diuretic? If I wanted to ask you, what is diuresis? Diuresis mean? Diuresis mean in relation with P. So what is diuresis? Mean increase P.
Increase the urine.
Right? Antidiuretic mean?
Decrease.
Decrease P. All right. So decrease P means where is the water going?
Inside the body.
Inside body.
Inside the body. Antidiuretic hormones is one of the hormone which is retaining water, because otherwise if we don't have antidiuretic, our water, the fluids from our body will keep on getting out. There will be super dehydrated.
You can go back to the front desk.
All right, guys, please mute yourself. Please respect everyone here, or mute yourself. Okay, so retain the water. So what is ADH? Antidiuretic hormones produced in hypothalamus and stored and released in pituitary gland. Now these are opposite to each other, SIADH and DI, and I will teach you an easy way how to remember this. But first of all, because as you know, it is antidiuretic hormone, you should know that how it works, where it works. All right, where it works in kidneys. All right, you must understand how ADH works and how it works. What is happening with antidiuretic hormone? It causes the body, ADH antidiuretic means you will retain the water. And how you will retain the water? By constricting the blood vessels in the kidneys. It works in the kidneys and it will constrict the blood vessels, and your kidney is not letting all the fluid going out. Now, when I'm saying antidiuretic, so let's say if I'm telling you I have too much of antidiuretic. So what does it mean? Antidiuretic mean, will you be peeing?
No.
No. So I will not be peeing. Means I am retaining too much. Antidiuresis, I have too much antidiuresis that I can't pee anymore. So mean I am retaining too much. Understood? If I am saying I have very little, the ADH is absent. It means that I am urinating all the fluid, all the water out of my body. how to remember which is increased or decreased, I will give you a good formula. DI, what is DI? Diabetic insipidus. DI means D for DI, D for decreased ADH. SIADH means super, I for increased ADH, super increased ADH. In DI, what is happening with your ADH hormone?
Slow.
Low. And SIADH, what will happen to your ADH hormone?
It's too high.
It is too high. One way to remember is the sign and symptom is that you should know what is ADH. DI means decreased ADH. SI means super increased ADH. All right. And then you can relate yourself that ADH mean antidiuresis. If I have too much antidiuresis, I'm peeing too much. If I'm not peeing too much, and if I have very little of ADH, I'm removing everything out. So you can remember that one. But I have another trick to remember the sign and symptoms. But this is one of the remember, like how to remember which one is increased ADH and which one is decreased ADH. Now, from this slide, what did you understand about diabetic insipidus? It is decreased ADH, mean you're peeing too much or less? Less ADH antidiuretic means
Increase urine.
increase urine. So now tell me why we call it as diabetes insipidus. That is the reason why this is the reason. What is a sign and symptom of diabetic mellitus?
Polyuria, polydipsia, polyphagia.
All right. And what is a sign of DI? Polyuria.
Crazy urine.
All right, crazy urine output. Only because of urine output, that is the similarity. That is why it is sharing the name of diabetes. But otherwise, there is absolutely no relation with DIA, diabetic insipidus and diabetic mellitus. Got it? So they are two separate conditions and are not related. Even they share the name same diabetes, but the diabetes is due to the polyuria. Now let's discuss more about antidiuretic hormones. Okay, so as I told you, it is secreted from the pituitary gland. Do you know where is pituitary gland located in your body? Do you know where is pituitary gland located in our body?
It's in brain,
The brain.
It's below the brain.
near hypothalamus.
It is actually, yeah, near the, like, what is happening between the two eyeballs, like here, like inside the brain. So it is like under the brain, but between our eyes. So what is happening whenever you have any, like head injury, if any surgery, craniotomy happened, skull injury happened, or anything. So those people have commonly, they can experience SIADH or DI. And that is the reason that which patient have common SIADH. Are they born with that? Maybe autoimmune disorder, yes, they are born with that. But most commonly, it is a surprise that if anybody has head injury and their pituitary gland is being, like hit by severe injury, then it can happen. All right, so craniotomy, head injury, sinus injury, because sinus is also present here. All right, and the causes, what is happening? It causes the antidiuresis, means holding of water. And another thing is, I just wanted to tell you, I have a glass of water. All right, I have a glass of water. Let's increase the size of glass. So I have one spoon of salt in it. All right, so it is tasting like just one spoon of salt. All right, little bit of salty. And what is happening? My son came and he added another glass of water on this one. So what will happen to the sodium level in this glass? In glass number 2?
Low.
All right. So the thing is concentration matter. All right. So for example, I have one spoon of sodium here. in 100 ml of water, but now I have the same 1 spoon of salt in 200 ml of water. So which means that if I have too much water in my body, what will happen to my sodium? Too
Hyponatremia.
It will be low.
much water in your body will cause.
Hyponatremia.
All right, very good. And let's imagine I have a third glass. All right, so it was a normal water with 1 spoon of salt, and I made it, boiled or something. The water is all gone. So now it is only this much, half of it is written, like half of the glasses water is there. So what will happen to the salt consistency of fuel? It will
High.
increase.
High.
Just in case, if you have too much water in your body, not body, in your blood, sodium consistency will be low. And if you have too much dehydration, all right, and if your water and the fluid is too low, what will happen to your sodium?
High.
Hyper.
All right. Now I was telling you about antidiuretic hormones. The funny part with endocrinology is the science that because our body is releasing the hormones, luckily the science have invented all kind of hormones. If you don't have any kind of hormones, we have the artificial pill. If you are not producing insulin, we have insulin. If you don't have thyroid, we have thyroid. If you don't have antidiuresis hormone, we have antidiuresis hormone. You don't have parathyroid, we have parathyroid. Every single hormone, your pancreatic enzyme, if you don't have, we have pills for everything. All right. Now, antidiuretic hormone, as I told you, we have in our body. We call it as, there is a name of antidiuretic hormones, of course. And the name of antidiuretic hormone in our body is vasopressin. What is that? Vasopressin. And just like we produce insulin and we give insulin, same. If we have vasopressin, if it is less in your body, antidiuretic less or more, whatever, we can give the artificial vasopressin. And we also, sometimes it was written vasopressin, sometimes it's called desmopressin. Pressin is the one. Now let's discuss the sign and symptom. It is also very easy to remember. So tell me first of all, SIADH, what will happen to the ADH hormone?
Polyuria.
Remember, ADH means
Super increase.
Super increase of AD.
increased ADH. Got it? And DI means
Decrease ADH.
Is decrease AD.
DI.
yeah. So how to remember the sign and symptoms if you want to save the time? SI mean soaked inside, and DI mean
Right.
right? But you know, if you know the sign, ADH, what does ADH do? What does ADH less and high mean? But to be very quick, this is the easy way to remember. SI mean super increased ADH, and what it will do? You will be soaked inside. And why are you soaking inside? Because are you peeing?
No.
No.
No. I am peeing, but very less. Why DI mean decreased ADH, and why you are dry inside? Because you are peeing too much. Understood?
Yeah.
Now another thing is, because I wanted you guys to remember one thing is sodium. Now the issue is whenever there is water intoxication, in case some people, I don't know if you have heard or not, if you will drink too much of water, you can die with water intoxication. All right. So what is happening here? Soaked inside, you can have water intoxication. So what is happening? What it will do to your sodium level?
Low. Hyponatremia.
It will be low.
Right? Very good. And here, what will happen? In sodium,
Sodium will be increased.
whenever you will see sodium, it is giving the sign and symptom of neurosystem. Same as potassium. Potassium, if there is a hypo or hyperkalemia, which organ it will affect?
Heart.
Heart and
Same. Sodium, it will affect your nervous system, neurosystem. Calcium will affect your muscles.
More.
Alright, so we have, I will give you, like, whenever we will be discussing the electrolytes, I can give you the easy way to remember. So sodium, always think of your brain. And just imagine if you have too much of water, sodium is decreased, hyponatremia, is one of the reasons for seizures. You have to check the nervous system, neurovitals every day because it is sodium and they mean sodium and for sodium and for neurogens. And if I have too much, I remember one thing also, very, very important. When I'm saying that I have too much of water in my body, I mean that it is in my blood, like blood vessels, in my blood or in my organs. It is not having edema. This is too much of water, but you are not having edema. Edema means that your hands, legs are swollen. You are not swollen, but your organs is full of water and your brain is full of water and your vessels are full of water. Now just tell me, if you have too much blood volume in your veins, what will happen to your BP? If you're soaked inside, what will happen to the pressure of blood?
High.
High. Very good. And if you don't have fluid in your body, what will happen to your blood pressure?
Low.
Decrease.
Got it? And what will happen? Another one I wanted to tell you, one was sodium. Another thing I wanted to tell you about one of the word osmolarity. Osmolarity, just in a simple word, I wanted to tell you, just remember the osmolarity or osmolarity means concentrated. Anything which is concentrated. All right. Now for this patient, now tell me what will be the concentration of his pee? Is he getting the water out?
No.
No.
Di-
So what will
diluted.
happen to the concentration of his pee?
Sticky, thick urine.
Thick urine, sticky and thick urine, mean it is so much concentrated, Specific gravity is increased, osmolarity is increased. What will be the concentration of his blood?
Is thick.
Blood is thick.
Thin. With the
Much watering.
Because he is having too much water in his blood vessels. So is it thick or thin?
Thin.
Thin. So in a normal word, if it is thin, it will mean less concentrated, mean osmolarity will be less, blood osmolarity. Now, dry inside. Why he's dry inside? Because he's peeing all the water out. So what will be the concentration of urine? It is too much diluted, too much watery.
Yeah.
It is concentrated or less concentrated? Less concentrated. Specific gravity is very less. Osmolarity is very less. Since he is dry inside, dehydration, dry skin, BP is low. All right, so those are the sign and symptoms. I will send you the link of this sheet. All right, and just give me a second because I did forget to send it to you guys. I will send it to you right away. Oh, not here. I think maybe in my other laptop. Sorry for that one, but I will send you guys this page. All right. Now, how to remember which one is increased or which one is decreased? As I already told you, this is the easiest way to remember. DI mean decreased ADH, SIADH mean super increased ADH. All right. So now diabetic insipidus. Let's discuss the DI means decreased ADH or who is dry inside. Because why? Because he's peeing too much. What is the reason I told you? What could be the reason of DI or SIADH is?
ADH.
ADH.
Huh?
Antidiuretic hormone.
Antidiuretic hormone. Why it is high or low?
Because of the head injuries.
First of all, it could be the head injury, trauma, or anything can happen. All right, so those could be the issue. Or kidneys is not receptive of ADH, brain trauma, tumor, damage of anything. Another thing, one of the medication, this is the medication declomycin, which is an antibiotic. So what is happening, if you will give this medication to the patient, what will happen? It will, DI mean decreased ADH. All right. It will cause the ADH production. It has the property to inhibit the ADH production and is also the treatment of SIADH, not production. It is wrong here. So what will happen? It will promote, not inhibit, but it will promote the ADH production. So in case if you are on this particular medication, it will stop ADH. So your ADH will be low and it can cause the diabetic insipidus. All right. Now, what is happening in SIADH when you have super increased ADH? This is the medication I can give it to the patient to decrease the ADH formation. All right. Another one, I just wanted to tell you, use your common sense that, for example, when you're giving BP medication, antihypertensive, and what is side effect of antihypertensive? If you are taking too much, it can further decrease your BP. All right. If you're giving the medication for your heart rate, it can further go it down. If you're giving a thyroid medication, if you're taken too much of thyroid pill, what will happen? Your thyroid will be super increased. Same diabetic insipidus means your ADH is decreased and you are giving the medication to increase the hormone and increase in just in case if you have taken too much of it, it can cause further increase too much of ADH. And again, if your ADH is so high in your body and you are on medication, which will decrease the ADH, and one day you took the twice tablet, what will happen to your ADH level? It will be super decreased, which is known as diabetic insipidus. So always remember the side effect of that medication. Or sometimes diabetic insipidus can happen with the during the pregnancy. Sign and symptoms, as I told you, it is very it is very important, students, because this is a diabetic insipidus and SIADH, Addison and your other disease, Addison and Cortisone's disease. I will teach you guys. So what is happening? The sign and symptoms are very important. So what will happen? DI dry inside, mean his urine is increased, polyuria. And when I'm saying increased urination, it is not normally increased. It is super increased that he is even letting 4 liter to 24 liter of water out in a day. And when he's having too much of water is out, what is going to have? Too much thirst. He's craving for water. He's craving for ice. Dry inside means he is dehydrated, dry mucous membrane, dry skin, dry degree skin turgor. And what is happening to the urine? Urine is too much or too less?
Too much.
Too much.
Too much. So mean urine is diluted. Is it concentrated or less concentrated?
Less concentrated.
Less concentrated means specific gravity is low. What will happen to your BP? Low. Extreme fatigue, muscle pain, weakness, and what will happen to your sodium? Hyper. All right. So again, please have the concept ready. Urine is dilute, means concentration is less. Mean less concentration means less osmolarity, less specific gravity. Blood is very thick, very concentrated. Why? Because sodium is increased and increased sodium serum osmolarity, and even the blood concentration hematocrit will be increased, and that is the reason. Now tell me, what is your role? Now I did told you about the sign and symptoms of this patient, that he is dry inside and what is the sign and symptoms and everything. So now tell me, I am your patient with DI. Medication, if you want to discuss, I'm more than happy. But tell me that what are the nursing role? What are you going to do the vital signs. If you want to look something specific, you want to educate me something, please tell me.
Monitor intake output.
Monitor intake output. Immediately, as soon as your sodium or your intake output, the flow status is imbalanced, always start the intake output. Very good.
Maintain skin integrity.
Skin integrity. Why? Because it is dry skin, right? There is a chances of dry skin. It can get wet so easily if the patient is not walking properly. Very good.
Less sodium in diet because of
Hypernatremia, very good. So respect the food, right? With those ones. And if he's dry inside, maybe how much the fluid? Do you want to give him more fluid or no?
Yes.
Yes.
with those kind of things. All right. And dry inside is one of and the cause is decreased ADH. Decreased ADH. So what is the treatment? You will get the artificial ADH. And artificial ADH is vasopressin or desmopressin. All right. So strict intake output, daily weight, safety. Why I'm looking for the safety thing? Is he not safe?
Sodium is allowed.
Because fruit and electrolyte imbalance is there in the body.
Fall risk.
Patient is weak, so there is a risk of fall also.
Very good. The
Patient has low BP. That's why.
low BP also, another sodium is low, his risk of seizures, neurosymptoms, right? And do not give the food which will make you cause more pee. What watermelon, grapes, garlic, berry, coffee, tea, it will make you more like urinatic. So do not give those. And then some of the cases, like if it is too much of like ADH is not being produced, give the artificial vasopressin. Desmopressin is we call it. And just imagine if you're giving the artificial ADH, what can happen? Always check that in case if he takes the double triple dose, maybe it is too much sensitive, the patient can become SIADH, super increased ADH, and he can become hyponatremic, water intoxication, soaked inside, all these signs and symptoms can happen. Got it? And some of mild cases which do not need any artificial hormones is chlorpropamide. Diabetes, we call it as. And the side effect for these medication is hypoglycemia. The patient can have less sodium. All right, so these are the signs and symptoms. Another is, now let's discuss SIADH. What is SIADH? Super increased
ADH.
Yeah. And what is the causes? Lung cancer, or there is a brain injury or any kind of injury in your brain, infection, central nervous system problem, and the drug, especially the drug we are giving these one, desmopressin, diabetes. What is happening with these drugs? What will happen? Your ADH will increase. And just imagine the patient is on this medication and he took too much of this medication. What will happen to the ADH? It will super increase. Super increase mean SIADH. Understood? Now, please tell me the sign and symptom of super increase. What will happen to the fluid?
Increase
What will happen?
fluid retention.
Yes. What will happen to the weight of the patient?
It will increase.
Increase.
Heart rate.
Low sodium.
Low sodium. Low sodium mean what will be the sign and symptom? Neuro. Confusion.
Seizures.
There's tremor.
Always remember with SIADH, S for Caesar, S for SIADH, basically because of sodium. And now the patient is super full of fluid inside the body. So that is one of the reasons that patient doesn't feel hungry all the time. He's having anorexia. All right. What is happening with the urine output for this super increased ADH?
Decrease urine output. Concentrated urine.
All right, very good. All right, fluid overload, hypertension, fast heart rate, low sodium, confusion. seizures, anorexia, low urine output with concentrated urine, which means specific gravity is high or osmolarity is high. How about edema? Do they have edema? Please remember, this is a medication. This is a disease where the patient is having too much water inside, fluid inside, but not having edema. And where is the fluid? Fluid is in the blood, intravesicular area. Vessels mean your blood, where the blood vessels are, or the organs such as your brain, not in the legs and hands. All right, so that is number one thing. So what will happen to the urine? Urine is concentrated. Concentrated means urine osmolarity is increased. Urine specific gravity is increased. Urine sodium is increased. Blood, too much of water in the blood. It is diluted. All right, too much of blood. And you know, osmolarity will decrease. Hyponatremia, anemia, BP will be low. Treatment. So what will be the treatment of this patient? Sodium replacement, because sodium is low. Seizures precautions immediately started. Will you give water to this patient to drink? Fluid restriction, no. And why I need hypertonic solution? Remember what is hypertonic solution? If I'm giving the hypertonic solution in the blood, what will happen to the concentration of the blood? Increase. And what will happen? It will remove the water from the organs, the surrounding. And I want to remove the blood. All right, or remove the water. And what is the treatment, by the way? I have too much of water in my body. So what do you think is going to be the treatment?
Diuretic medication.
Very good. Diuresis. Got it? All right, let's see. So first of all, daily weight, because weight gain can be happening. Intake output, again, same. Medical treatment, loop diuretics. All right, it will remove everything. So remember, loop diuretic, we have discussed everything, because whenever we are giving loop diuretic to remove the water from lungs or from heart failure or from SIADH or from this disease, always remember the side effect is the same. It will remove all the electrolytes, potassium, etc. So please watch the electrolytes. Hypertonic IV solution to remove the fluid from the cells. And declomycin, as I told you, this is the medication which will decrease the ADH, because the ADH is super increased. All right. This declomycin is a type of antibiotic once again. And the most important thing with you have, if you have declomycin, don't give it the calcium containing food or antacid, this particular medicine, because it is not being absorbed properly. All right. So still confused with the difference between diabetic insipidus and SIADH? So let's revise side by side. So let's, DI means what will happen to the ADH?
Decrease.
All right. And what is happening with the SIADH?
Super increase.
Good. All right. What will happen to the output, urine output? Dry inside mean the urine output is
High.
high. As super increase, ADH means soaked inside. The output is
Low.
And if the urine, like what is happening when you're dry inside, what is happening to your sodium level?
High.
High. And when it is too much diluted, your sodium is D for diabetes. Dry inside means dehydrated, and they are overhydrated. All right. And they lose too much of fluid. And the problem here is they are retaining too much fluid. The only common thing in them is they both have excessive thirst. They both have the excessive thirst. All right. Every time. All right. So do you have any questions for me for DI and SIADH? Anyone? Anyone have question for me? What is DI and ADH? SIADH. Did you understand?
Yeah.
Yes.
All right, if you understood, so let's discuss one of the questions. Suddenly, a client suddenly develops syndrome of an inappropriate antidiuretic hormone, which is SIADH, after cranial surgery. Which manifestation would the nurse expect to see from the client? All right, I just wanted to mention here. So many students are telling me and calling me that my numbers are not included, my scores are not included. So number one reason I'm telling you bluntly that it is that you are not using your brain at all. All right, I can guarantee that, because it is not that we haven't covered anything. Like there are many things that, for example, if you're scoring 50%, right? It doesn't mean that if you're doing 100 questions, only 50% you have studied and 50% you have never seen the question. It is never like that. Most of the time, you are only studying the English. You are not using the brain, and it is a fact. Another problem is students are telling me, ma'am, I'm always confused between two options, and I'm always, and this to my surprise, when I do the assessment one-on-one, the common thing, the mistakes, they are thinking that either it is A or it is B, both are wrong. Usually the correct answer they have actually taken, it is already out of their brain. All right, so what is the best way to deal with the question is always go with option one by one. Do not read all the options, read one option and apply the knowledge. Let me see how to apply the knowledge. For example, here I will check edema and weight gain. I will not go with any BCD. I have to think, is it right, wrong, or can I consider it? So SIADH, what I'm looking for, what is the expected sign and symptoms of SIADH? So tell me, edema and weight gain.
No.
No.
Very good. Because there is two
No
things.
peripheral
Weight
edema.
gain,
Fluid
yes.
inside the
Edema?
body.
No.
Edema, no.
Got it. Decrease urine output?
Yes.
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 BP will be?
High.
I.
All right. Urine specific gravity, urine will be concentrated or too much? Like
It will be
Concentrated.
concentrated. Mean high urine specific. And is it saying low? So what is the correct answer?
Decrease.
Excellent. Now let's do one more thing. The nurse is caring for SIADH patient. Which of the following actions should the nurse take? Select all that apply. All right. What are you going to do? Will you administer vasopressin?
No.
Very. SIADH mean super increase.
Super increase.
ADH.
Super
And what is vasopressin? It is also ADH.
and ADH.
So will you give ADH to the person who is also already super increased ADH?
No.
Excellent. So that is proper use of tape. Implement seizures precautions?
No.
No. And why?
Because the sodium itself is low in the body.
Sodium is low in the body and water is
High.
high. So do you think it can cause the sodium seizures?
No.
Yes.
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 What I told you very carefully that if you are forgetting thing, as for SIADH, as for seizures, sodium is directly linked with
Yeah.
seizures.
Yeah.
Hyponatremia means too much of water is your brain is swollen. Your brain is swollen means you're having seizures. Understood?
Yes.
Will you perform neurovital signs?
Yes.
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 Will you keep a strict record of fluid intake output?
Yes.
Yes.
Will you give IV fluid and IV fluid of isotonic solution?
Yes.
All right, very good. What is isotonic? Rutu.
No. It's
Hypertonic.
it's wrong. Hypertonic will give.
So what is this?
Will give hypotonic.
Hypertonic.
All right. So that is why. So do not get. So when the students like you guys are saying that, ma'am, I am very intelligent, you are. But there is a problem in the questions. I am absolutely fine. My scores are not improving because there is a problem in the NCLEX. So that is the thing. Understood? All right. Okay. So now let's begin thyroidism. All right. So please raise your hand who are having the problems of thyroid class. Like I have asked that is sorry, that is your personal question. But I wanted to ask you guys like what is your sign and symptom, and if you can relate any of your family members or anyone who is having thyroid issues, it is very common. Suchpreet, what do you have?
Hypothyroidism.
Hypothyroidism, and you are on
Yes.
medication?
And me,
Yes.
I have a hypothyroid.
All right. You too have Fahime?
Yes.
I
Alright.
also have the
Okay. So now it will be interesting to learn about the thyroid gland, and you please take it on yourself. Maybe you can get yourself, like you can take care of yourself in a better way. And if you have family member, you can take care of them in a better way. If you know the science behind thyroidism. Because otherwise, what we know, I have a thyroid, hypo or hyper, all I'm worried about is my medication. First of all, tell me where is the thyroid gland is located? Where it is?
Neck region.
Neck.
Of
Very good. In your neck. All right. So inside your neck, the important point I wanted to tell you that inside the thyroid itself, we have 4 little parathyroid glands. All right. In this picture, there is a color. It is color coded, yellowish. But in reality, it looks like the same. All right. So what is happening? Why I'm telling you at this point, I will teach you parathyroid gland. But what is happening when you will have any thyroid surgery? Let's say the doctor, there is a thyroid cancer, and doctor decided to remove the thyroid gland. Or there maybe he wants to remove half part of the thyroid gland, and there is a chances that he will remove the parathyroid gland as well. All right. Just in case, if we are studying about hypoparathyroidism, one of the reasons for hypo means less parathyroid gland is because it is removed due to the thyroid surgery. All right, now let's discuss about the hyperthyroidism. Now, what is happening? I wanted to tell you the easy way, just like the SIADH, I tried my best to give you a trick. With the thyroid gland, all right, I wanted to learn that what does thyroid do once you know that the sign and symptom is all clear. All right, so first of all, you should know what is thyroid gland and what are the hormones, thyroid hormones. So the T3, T4, you was telling me, these are the thyroid hormones. The full form, if you will see, triiodothyronin, and T4 is thyroxine. It is a thyroid hormone, T3, T4 in a short way. All right, so if T3 and T4 is less, it means thyroid hormone is less. Now, it is also producing calcitonin as well. Calcitonin means that it is parathyroid gland. When I will be teaching you, you have to remember parathyroid gland is basically the gland which is taking care of calcium. It is giving the calcium, like it is doing, like parathyroid mean high calcium, high parathyroid mean high calcium, low parathyroid mean low calcium. And just in case if your body is producing too much of calcium, I have to have something in my body which will decrease it, and calcitonin is the one which will decrease it, and it is being produced by thyroid. Let's not talk about calcitonin here. Now, thyroid gland, what does it do? It is helping in metabolization of your body. All you need to remember is metabolization, that's it. Metabolization means that whenever I eat, whenever I work out, whatever I'm doing, when my cell is burning the calorie, That is what it is, metabolization, right? When I'm digesting something, when I'm eating food, it is getting metabolized and it is giving me the energy. So T3, T4 plays an important role in burning the calories. For example, if I have too much T3, T4, I mean hyperthyroid, what will happen to the burning calories? It will too much burn as calories, right? Agree? Whatever the patient is eating, everything is burning so much. All right, and that is why what will be the weight of this patient?
Low.
Low. And the patient who is having hypothyroidism, if you have hypo or hyper, what is happening? Are you burning the calories? No, because your body metabolization is low, and that is why your weight is high.
Can.
And if you are not burning the calories, all right. So first of all, burning the calories also produce the heat, right? Whenever you're burning the calories, it will produce the heat. If you're not burning it, what will you feel? Cold or hot?
Cold.
Cold. So that is why if you are having hypothyroidism, you will feel too much of cold. And if the person is having hyperthyroidism, he is resistant to cold because he's burning too much calorie. His body is producing too much of heat. He can't resist the warm weather. All right. And everything, thyroid means everything is high. It will replace the dying cell. It is telling you how fast we digest the food. The person with hypothyroidism, they are not digesting the food very often, like in a easy way. It will stimulate the sympathetic nervous system, alertness, quick responsiveness. And if you are having low T3, T4, hypothyroidism, what will happen to you? You are very sleepy all the time. You're very lazy all the time. All right. Body temperature will increase, heart rate will increase. It is good for brain development, muscle contraction, fertility. Hypo, hyper, both. They do affect the fertility of the person. All right. And what is happening? This TSH. TSH is, you can say that it is produced by the pituitary gland by itself. In case it is a stimulating hormone. If you're having hypothyroidism, what will happen to my brain? My brain will say, Alveen, your thyroid is too low, your metabolization is too low. You have to produce too much of thyroid. And my thyroid is T3, T4 is being produced by whom? TSH. If I have the orders from my brain, and how my brain is ordering it with the help of TSH. Usually when you will see your thyroid report, sometimes you will see that my T3, T4 is good, but my TSH is high. TSH is high, that your brain is giving too much of orders that produce the T3, T4. All right, so that is the problem over here. So whenever you're having the diagnosis T3, T4 and TSH, it is usually the opposite of the hypo or hyper. So if you're having hypothyroidism, your TSH is high, and you're having hyperthyroidism, I mean too much of thyroid hormones are there, your brain is giving the less signal, less TSH. Another one is thyroid, right? It cannot make the thyroid hormones without iodine, which is coming from food. So for example, if I am eating less iodine, so what is happening? So will I produce thyroid hormone?
No.
So the patient will be having
No.
hypothyroidism.
No.
If I am taking too much of iodine, my thyroid will be increased. So that is another thing. All right. And I hope you are aware of this one, that T3, T4, let's say, if your body is having too much of thyroid, T3 and T4, it is telling your brain, all right, to secrete the TSH, and TSH will produce T3, T4. And if it is less, all right, it will produce the TSH. And if it is more, then it is telling your brain that too much of T3, T4 is here, stop the TSH, stop producing it. So it will produce less TSH. Now let's discuss one by one. Hypothyroidism, I did explain it to you, but still we will discuss a little bit in detail. Hypothyroidism means less thyroid. And what are the blood tests we do? Less thyroid means T3, T4, and TSH. Sign and symptoms will be, everything will be low and slow because your metabolism is low. Hypo means low metabolism. All right. And what will happen to your weight? If nothing is burning, nothing is, like what is happening to your weight?
Gain.
Gain. Will you be cold or hot?
Cold.
Cold.
All right. And low thyroid will ask the body to produce the thyroid. So your TSH will increase or decrease? Increase. All right. I don't wanted to mention this point. I will explain it later. Will you be more tired or active?
Tired.
Tired. All right. Weight is gain. And what will happen to your heart rate? Everything will be low and slow. All right. Heart rate will be
No.
What will happen to your GI system?
Is slow.
Low.
Means
Low.
constipation. What will
Constipation.
happen to your mood?
Constipation,
Yeah. What will happen to your mood?
No.
Low.
depression.
Low mean depression.
Yeah.
Yeah.
All right. So those kind of things. So let's discuss weight gain, unable to tolerate cold, extremely tired, extremely fatigued, slow heart rate, brittle hair, right? It is breaking, depression, constipation, memory loss. Myxedema is, what is myxedema? Myxedema means the swelling of the skin and it looks like a wax. It is easy to remember. I will tell you how, but I will explain the myxedema later. But you should know what is myxedema, all right? Swelling of the skin. I will show you the picture. Dry skin, muscle pain, menstrual problem, and the most of the time, first sign and symptom of anyone who is with having hypothyroidism is feeling the tired and fatigue. All right. If you are the one feeling tired all the time, it could be hypothyroidism. And the causes, why hypothyroidism, why my thyroid is not working. All right, very commonly it is affecting the women. All right, or there is a thyroid, your thyroid is not working because there is an inflammation or there is autoimmune disorder that it is not being produced. Iodine deficiency, you are not taking iodine, or there is a tumor in your pituitary gland that it is not releasing TSH and TSH is not there, T3, T4 is not happening. So what is the treatment? The treatment is, everybody knows, what is the treatment?
Levothyroxine tablet.
Levothyroxine is the tablet. All right. So the first treatment is thyroid hormone replacement. Give the thyroid pill, thyroid, levothyroxine, etc. Very, very important point is this one. So first of all, what will happen to your body? It will decrease or increase? Decrease. All right. Everything will be decreased. Now another point, common thing, you should always keep that in mind with your endocrinology. Whenever any kind of hormones, endocrinology is there, if insulin is there, thyroid is there, DI, SIADH, whatever is this, Addison, Cushing disease. So whatever the problem you have, whenever you are sick, it sucks. All right. For example, if you're sick and you're having insulin problem, you're having diabetes, what will happen when you're sick? It will be super increased. All right. If you have those kind of problems. If your ADH is low or super increased, whenever you get sick, it started that particular problem. It is too much at same happened with hypothyroidism. First of all, when they are sick, what will happen? It will be super low. All right, whatever the issue is, it is increased. The sickness will increase. So what is happening? Whenever I am having sign and symptoms, the sign and symptom of any drug is like, for example, hypothyroidism is my body is low. All right. And when I'm sick, what will happen? It will be super low. Agree? And please do not give these patients sedatives and narcotics. Why? Because what will happen? What will sedatives and narcotics do to your body? Low or high?
Low.
Low. First of all, I have the thyroid making it low. Then I have the illness which is making it low. And then on top of that, you give me the medicine which is keeping it more low. They are so sensitive. So your body will be low, super low that you can go into coma. And if we will not treat you, you can go to super low than coma means die. All right, now let's discuss mixed edema coma. What is mixed edema coma? It is life-threatening condition when the patient is not getting the medications of hypothyroidism, he's skipping the medication, not eating the medications, or the patient is sick, undiagnosed. All right, during those coma, your body will be low, super low that it will cause the coma, mixed edema coma. That is how you can remember. Coma means low body thyroid related to hypothyroid. And causes are again illness, stress. Your body is too much under stress. You will have medications such as sedative, narcotics. All right, what else can make it super low? If the person is having anti-thyroid medication, for example, the patient thyroid was so high, which he was on anti-thyroid pills, and he took it so much dose that it is so low that it leads to mixed edema coma. All right, so thyroidectomy, removal of thyroid can cause mixed edema coma. The sign and symptoms is usually the same. Everything is low, slow, but it is super low. And it causes a mixed edema coma. Mixed edema, as I told you, what is mixed edema? Swollen skin and having the waxy appearance. Look like this is the person. Now look at her skin, brittle hair, too much waxy appearance. All right, what is happening with mixed edema coma? The patient's body is slowing down to the point of death. And what will happen to the body temperature? Hypothermia, agree, right? Mixed edema, swelling of this one, these are the signs and symptoms. That is why it is known as mixed edema coma, not only coma. Heart rate will be low, BP will be low, respiratory rate will be low, glucose will be
Low.
low, sodium will be low. And sodium low means very confused, drowsy, seizures. Everything is same. Everything is the same. Agree? Now, we know that if the person is having normal hypothyroidism, I will give the medication thyroid pill. Now, let's suppose the patient is having mixed edema coma. Do you think this patient is in their home? No. They should be admitted. So, let's discuss what are you going to monitor first of all. So, tell me, any vital signs specifically you are looking for?
Heart rate,
Heart rate,
Heart rate,
blood pressure,
Pressure,
respiration, everything.
temperature,
temperature,
everything, because it is low.
Decreasing everything. Yeah.
Excellent. All right. So what is happening? So another thing. So what is happening with the vital signs? We have done that. Hypothermia. For hypothermia, how will you treat the hypothermia? Don't
warm
be a doctor
blankets,
who is writing everything down. You use the nursing consideration. What are you going to do?
Provide
warm blankets,
Warm blankets. Very good. All right. Heart rate is low, low BP. I'm monitoring it. Low blood glucose. What do you think doctor is going to order it?
Glucose.
IV glucose.
Yeah.
Low sodium, maybe doctor is going to give sodium medication. And what is the reason behind mixed edema coma? What is the reason behind it? The thyroid is low or high?
Low.
Low.
Hypothyroidism.
What is the treatment? I will give the thyroid.
Thyroid.
And mixed edema coma is the one where we are giving IV. Sometimes we have to give the IV thyroid. IV thyroid, it is present. We are not giving to anyone, just in case if the patient is having mixed edema coma. And what is the side effect of IV thyroid? If you're giving too much, what can happen?
Hypothyroidism.
Hypothyroidism can happen. And how do we know the patient is in coma? How do you know the patient is having sign and symptom of hyperthyroidism? His heart rate will increase.
Increase temperature will increase.
BP is increase.
Sweating.
Simple. All right, so let's discuss. So monitor heart rate, BP, respiratory system, give the IV solution, IV thyroid hormones. All right, check the sign and symptoms of hyperthyroidism, administer IV glucose, give the warm blanket. Do not give the sedatives. The patient is on mixed edema coma and you give the sedatives. Will it happen? We are not even avoiding it to the hypothyroid patient. And mixed edema coma, no. Wait. All right, I wanted to ask you one question. Let's imagine the patient is having the surgery. All right. The patient is going to have the surgery with hypothyroidism. All right. So, first of all, surgery means he is sick. Right? Body is low. Hypo means low. He is sick, low. Surgery. After the surgery, what is happening? What will happen to his hormone? It is a stress. It is a physical stress. What will happen to the physical stress? Whatever the problem is, it will aggravate. It will be super low. And do you think the doctor is going to do the surgery without giving him narcotics or anesthesia? No.
No.
We have to give the anesthesia, right? What will do anesthesia will do?
Sedative.
Sedate.
Low. So now this is a big thing for the hypothyroidism patient. Not for you, but you, if you are taking care of the patient of the hypothyroidism. Let's suppose common thing, doctors are taking care of hundreds of patients and they do forget who is on which medication. They are in so much rush that they orders, hold all the medications. They are right, hold all the medication because before their surgery, right? And you are the nurse and you see that this patient is on thyroid pill. Will you hold it?
No.
No.
Why? Because if you will hold it, the patient can die. Will be super duper low. And what will you do? Immediately call the doctor and tell him that you can't hold this medication. All right. And in case if the doctor is giving you the attitude, just in case, don't stop it there. You can call the anesthesia doctor. Right? That the patient is put on hold. And they can have a talk because you as a nurse, we are teaching you that what is good and what is bad for the patient. All right. And if the patient is having surgery, he will be NPO. And if you will not give thyroid, they can go into coma during the surgery. And during the surgery, on top of physiological problem, they are also giving the sedation so they can die. So never ever hold the thyroid pill. And if the patient, you are seeing it is hold, immediately call the doctor or anesthesia doctor himself. All right. So this is thyroid. So in mixed edema coma, we have studied about that these are some of the tips and thyroid medication. And what is the tip? What are the education tips for the thyroid pills? Very important. Common thyroid medication we give is levothyroxine. All right. And what are we going to give the education to the patient? First of all, you tell me at what time you take the thyroid pill. Everybody knows.
Empty stomach in the morning.
Early in the morning. All right. So don't abruptly stop taking this medication. And do tell them the patient is saying that the doctor started me on the medication like from last couple of 3 days ago, but my sign and symptoms are still the same. What does it mean? Does it mean that medication is not working? No. Tell them that it will take a while. Give yourself a time. It will take a while for sign and symptoms to improve. And take it same time every day. And when is the best time? Morning, without food. And in case if the patient is on multivitamin, if you are taking the multivitamin, there should be minimum gap of 4 hours. The reason is when you take the medication and on top of that you're taking the multivitamin, your intestine will absorb the vitamin first. It will not absorb the thyroid. So if you want to take the multivitamin, take it in the evening, right? 4 hours later. That is the best time. And of course, when you are giving the thyroid pill, always look for the toxicity sign. Means toxicity, my sign means his or her thyroid can be super increased. So always monitor those things. All right. Note, the patient with hypothyroidism are sensitive to narcotics and other sedatives, and it can lead to myxedema, coma. So in case if they need the pain medication, give the non-narcotic pain medication like Tylenol, Brufen, Advil, give those ones. All right, understood. Hypothyroidism. All right. Now let's discuss Hashimoto. What is happening with Hashimoto disease? It is another name. So what is happening? The hypothyroidism means your thyroid is low, everything sign and symptom is low. And in case if you will not treat it, if you missed your pills or something, myxedema, coma can happen. But if you are having thyroid issues because there is autoimmune disorder, which is actually killing the thyroid gland, and the thyroid problem is because of the autoimmune disorder, we call it as Hashimoto disease. Hashimoto disease, what it is? It is hypothyroidism. The sign and symptom is hypothyroidism, but it is just a fancy name because it is happening because of autoimmune disorder. Got it? So I'm not going into depth with the Hashimoto disease because sign and symptoms and everything is fake. Just Hashimoto is autoimmune disorder at the order of thyroid gland. All right. And because your immunity is leading the death of thyroid hormones, so your hormones are decreased. All right. And in case if you have other autoimmune disease like diabetes, Jordan's, vitiligo, and rheumatic arthritis, autoimmune hepatitis, it can further trigger it. All right. And the sign and symptoms are actually, you will see the same: increased sensitivity, increased sleepiness, etc. All right. So these are the, so for example, again, let's repeat. So what is hypothyroidism? Means
Low T3.
your metabolism is low.
Low.
Everything is low. All right. If your hypothyroidism is super low, we call it as
Myxedema, coma.
myxedema, coma. And in case if thyroid is happening because of autoimmune disorder,
Hashimoto
Hashimoto.
Hashimoto disease.
All right. Got it? All right. Anything, any questions so far? Understood? Do you want break now or maybe you want the break later? I will discuss the hyperthyroidism. Do you want break? Students, tell me.
No.
No.
Is it interesting?
Yes.
Okay, got it. All right, now let's discuss hyperthyroidism. Hyper means hyper secretion of thyroid means your metabolism is too much.
High.
What will happen to your body? It means that your metabolism is too high. Your calories are burning too much. What will happen to the temperature of the patient?
Warm.
Increase. Heart rate will increase. BP will increase. Respiratory rate will increase. GI system
Increase.
So what does it mean? Constipation or diarrhea?
Diarrhea.
Diarrhea. All right. So what else? Like heart rate will increase. So heart rate is increased. It can increase to that level. It can cause tachycardia, SVT, VFib, those levels. All right. What will happen to your mood? Hyper, irritable, moody. What will happen? You will be insomniac or you will be sleepy? Insomniac. What will happen to your weight?
It will be lost.
Low.
All right. So these are the weightless, heat intolerance, tachycardia, hypertension, diarrhea. Because too much of blood is running, so smooth, the skin will be smooth, not dry, soft hair instead of brittle hair. cardiac dysrhythmia, personality change like irritable, moody, insomnia, irregular menstruation cycle in the women. And now the reason why your body is producing too much of thyroid. The number one reason is like cancer, with the cancer. Iodine, what can cause the iodine? High iodine or low iodine?
High
High
iodine.
High
iodine.
iodine. Or if there is any infection in your thyroid, it is producing too much. And we have grave disease, I will discuss later. Toxic nodular goiter, all right, it is not autoimmune, but it is like toxic nodular goiter, or we can say it's thyroid storm, we call it as, all right. And the medication we will discuss later, the medication is anti-thyroid, all right. And thyroiditis, inflammation is happening, too much thyroid is being produced or too much iodine is there. Now, what are the nursing intervention? So first of all, let me ask about the temperature. So what is the temperature of this patient?
High.
So what will you give? How you deal with that?
Cold compress.
Will you give a warming blanket or cooling blanket?
Cooling.
Cooling.
Very good. Another thing is about sedative. I told you, do not give sedative to hypothyroidism. Can we give to the patient hyperthyroidism?
Yes.
Yes, because of insomnia.
Very good. Sodium has not played. Sedatives mean your body will be low down. Do you want your body to be slow down? Yes. Sometimes we can actually give the sedative.
Sedatives.
What is happening with the weight of this patient?
No.
It's weight loss.
Weight loss. So can you check the weight of this patient? What do you think?
Yes.
Yes.
The weight, right? Another thing is what is happening to the heart rate, BP, etc.
High.
Increase.
All right. And hyperthyroidism, what could be the medications? Hypothyroidism, I will give the thyroid pills. And hyperthyroidism, I will give antithyroid. And I will teach you few of them. What are those one? Educate about the medications. Monitor for thyroid storm. Just like mixed edema coma, what is happening? Mixed edema coma means when your hypo means less, and if it is super less, it is known as mixed edema coma. And in case if you have high thyroid, and if it is super high, we call it as thyroid storm. Storm of thyroid is happening. All right, thyroid storm. And the reason thyroid storm, the sign and symptom, fever. Fever is super high, mean 106, 105. Heart rate 180, BP 200 by 180, like those kinds of things. All right. The sign and symptom, again, the patient is sick or so. We will cover thyroid storm later. All right. Very, very important topic. All right. What nursing intervention do we continue? Education about antithyroid pills. There are different type of antithyroid. Whatever the type of antithyroid pill we will be discussing, PTU or a radioactive iodine or whatever, you have to tell them, do not stop taking this abruptly. Never stop taking abruptly, same like the other medication. Take at the same time and look for the thyroid storm of this patient. How about the diet? Do you want to give the iodine diet to the hyperthyroid?
No.
Less iodine.
Iodine rich. Remember the medication which can cause the hypothyroidism? Doxycycline, remember? Right? One of the antibiotic which can cause it. Same. We have another medication, we call it as aspirin here. Aspirin is the medication which can increase the thyroid. In case if you are having hyperthyroidism, aspirin can super increase it. Do not give aspirin to hyperthyroidism patient. And do not give doxycycline to hypothyroidism medication. All right, and then look for the toxicity of this medication like hypothyroidism. Like if the antithyroid medication is given too much in the blood, what will happen? Hypothyroidism will happen, or mixed edema can happen. All right, on top of antithyroid medication, which I will be giving you the name very soon, we have to give the what is happening to the blood pressure of this patient and heart rate of this patient.
It's high.
Hi.
So I am going to give the medication which will affect the heart rate and decrease the BP. And the safest drug at this time is beta blockers. All right. So this is the one we are given. Now let's discuss some of the antithyroid medication. What are those could be? So what does iodine do? If I have too much iodine, I will produce too much of thyroid. Remember?
Yes.
I will give radioactive iodine. Radioactive means killing iodine. All right. Radioactive mean radioactive. If you remember that we are giving to the patient the radiation to the cancer patient to kill the cells. So if I will give the radiation iodine, what will happen? It will attach with the thyroid gland and it will kill the thyroid gland. All right. So radioactive iodine sometimes we are giving to this. But whenever there is a radioactive part, please do not give to the pregnant ladies and nursing women. Even the radiation therapy, even you are a nurse, if you're pregnant or if you're planning to get pregnant as a nurse, do not work over there. Another radioactive iodine tastes like a metallic taste. So do tell them that your taste can change. All right. All right. And nausea, swollen salivary gland. Antithyroid medication is one is iodine. All right. Another one is radioactive iodine. Another is PTU.
Methimazole.
Yes. Another, we will discuss couple of them. Another is surgery also, right? What kind of surgery do you think we are going to give to this hyperthyroidism patient? For example, there is a cancer, too much of thyroid is there. So what is the safest thing? We will
Thyroidectomy.
thyroidectomy. Now tell me, thyroidectomy means removal of thyroid gland. So what will happen to the thyroid gland? So will I produce thyroid? No. So teach this patient that they will be forever on their life. They have to take the thyroid. Got it? Another one, I just wanted to tell you an interesting thing about thyroid gland. It is very spongy in nature. This thyroid gland, it is very spongy. Spongy, why I'm telling you is that whenever there is any manipulation, if you will touch it, not on top of skin, for example, if the doctor is opening it and if it is touching it and doing something, it will release a lot of thyroid into your blood. Simple, a little bit of scalpel, if it is touched on the thyroid gland, it is full of, you can say, like syrup, sponge, full of syrup. And if you will press it, it will release the syrup out of the body on the blood. So what is happening during thyroidectomy? What is thyroidectomy? Doctor is removing the thyroid gland. And how he's going to remove the thyroid gland? By actually touching it. Now, what is happening during the surgery? What can happen? That manipulation of the thyroid gland by the doctor, it gives a gush of thyroid, like thyroid hormones into the blood, and the patient can have thyroid storm during the surgery. So that is why when the patient is going for thyroidectomy, usually in the OR system, they have all kind of medications like beta blockers, the BPs to control the heart rate, to control the temperature, to control. We know his body is going to be hyper. So we have all those kinds of medication. All right. So watch for thyroid storm due to the manipulation of gland causing extra T3 and T4 leaks into the body. And that is why we do prepare anti-thyroid medication, sodium iodide solution, beta blockers, steroids, everything is ready in the OR. And where is the sutures? Now let us say that they remove the thyroid. So where is the suture first of all?
On the neck.
on the
the neck.
And what is the problem? The biggest issue is whenever you have any kind of surgery, tracheostomy, laryngectomy, any kind of neck, like any nerve problem or anything, if you have any kind of surgery over there, the issue is airway. All right, after the surgery, you have to teach the patient about those sinus symptoms, infection, right? Coughing and splinting. It is sutured, so UP has to supplant the neck. All right, and maintain the airway. Very, very important. And I told you one more thing, that during the thyroidectomy, when the doctor is removing the thyroid gland, there is a possibility that he will remove the parathyroid gland. Agree? Like, remember? So what is happening after the thyroidectomy? First of all, yes, there is a chances of thyroid storm because during the manipulation of that one, right? During the surgery, there is a gush of T3, T4 into the blood. And this airway maintenance is another issue. And the third one is we are keeping very close eye on the parathyroid hormone after the surgery, because we don't know if the parathyroid gland is removed or not. In case if it is by mistake, it is out. How do we know? What blood test we are going to do? Calcium. We are checking the calcium and phosphate because PTH, parathyroid hormone, is directly linked with your calcium. All right. So what is the education of the patient? About the post-op, coughing, deep breathing, supplanting, monitor the parathyroid destruction problem, right? Which is very common. And calcium level, hypocalcemia can happen because parathyroid is gone, calcium is gone. Hypocalcemia will occur. All right. And watch for the respiratory distress due to the nature of surgical site. It is in the neck. So keep the patient semi-forward position. And post-operative risk factor, as I told you, the post-operative risk factor, airway, hemorrhage, it can happen within the first 12 hours. These are the things which is I'm worried about. And later, I'm worried about that parathyroid gland is removed or not. And after that one, how do I check? Calcium will be super low. And if the less calcium is there, tetanus can happen. And only after 48 hours, if you are risk of the patient is risk of infection, yes, he is. But only after 48 hours, bacteria will slowly grow over the period, like over the infection, the suture site. But it won't happen at sudden first 12 hours. It is airway, hemorrhage, tetanus, etc. All right, so this is hyperthyroidism, thyroid storm. I will going to cover soon. Another one I wanted to discuss is Graves' disease. Graves' disease, just like myxedema coma, as I told you, hypo means everything is, hypothyroidism means hypothyroidism, everything is so low that it will go to coma. We call it as myxedema coma. Hyperthyroidism, in hyper, so everything will be high, that you are running to your grave. Running to your grave. And then we call it as grave disease. That is how you can remember. Running toward your grave because you are hyper and running. All right. Grave disease means it is also increase in thyroid. But this one, just like Hashimoto disease, it was autoimmune disorder. It is also autoimmune disorder. All right. Of increased thyroid. Run yourself. It is autoimmune disorder due to the production of antibodies, which is not letting the, like you are having too much of production of TSI. TSI, it is the same effect of TSH, and this is mimicking the TSH, and the body is thinking that I have to produce T3, T4, T3, T4, and it is super high. So again, the medications will be the anti-thyroid medication. Beta blockers are very important for the heart rate and the blood pressure. All right, and radioactive iodine, thyroidectomy, the same one. PTU, one of the antiviral medication I was talking about. What you can remember, PTU's full form is propylthiouracil. All right, PTU. But you don't have to remember propylthiouracil. If there is PTU in your exam, you can remember PTU means put thyroid under. Means this is antiviral medication. This is the medication which will decrease the thyroid. Actually, it is one of the cancer medication, all right, which is decreasing the production of the cells. Thyroid is also a cell, all right. So that is one of the common, and as like other cancer medication, it has the same effect. It will give your immunity, like it will make you immunocompromised. So always watch the WBC. And again, grave disease, thyroid storm, everything, the same thing. Thyroidectomy removes the total thyroidectomy, and then teach the patient that you will be on lifelong thyroid medication. And sign and symptoms. Grave disease, sign and symptoms will be the same. Hyper, every single thing. Weight loss, heat intolerance, heart rate, BP, diarrhea, and everything will be super increased. Not except few, but it has additional few other sign and symptoms. Just like myxedema, coma have that waxy appearing, it has few typical other sign and symptoms, and those are these unique sign and symptom are, first of all, if you have seen these kind of protruding eyeballs, your eyeballs are so much protruding. All right. I don't know if you're from India, if you know one of the actor Irfan Khan, right? So his eyeballs are protruding. So he had hyperthyroidism, right? So hyperthyroidism means eyeball is protruding. Exophthalmos, we call it as. Goiter means too much of production and it is so much swollen, we call it as goiter. There is also myxedema. It is not myxedema coma. You are not going into coma. It is hyper. Myxedema is there. Usually it is very common in the feet of the patient. I just wanted to take a little depth into about this eye. If you have too much protruding eyeballs, do you think when you are blinking your eyes, is it closing properly?
No.
No. So what will happen to your eyes? It will be dry.
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 So now tell me, what is the treatment of dry eye?
Artificial tears.
Yes.
Artificial tears, right? So those kinds of things. So you can tell them, use the artificial tears. And I don't know if anybody has experience, like I have experienced in, like if you guys are care aid, maybe you have seen this. We are taping the eyelids during the night time, because when these patients are sleeping, their eyeballs are so much protruding outside that they can't close the eyelid. So we are putting the tape onto the eyelids. All right. And because your eye is having too much fluid and pressure, we are simply, the best position is sitting, because it will drain all the fluid from the periorbital area to the back, and give the steroid medication, and tell the patient to go and visit the eye doctor, and use the dark glasses to decrease the glare, and restrict the sodium intake to decrease the periorbital edema, and do the exercise. Which exercise? Eyes exercise. Turn the eyes from one range of motion, right? So eye muscles exercise, we call it as. All right, what is your intervention of grave disease? He's running toward his grave, mean he's going to die, just like myxedema coma. Very, very careful. Monitor the heart rate, BP, ECG, weight. Keep the patient cool. And again, the medication, PTU, the same thing. And another common medication, we call it as methimazole. This medication is a common treatment for grave disease. If the person is having like autoimmune disorder, grave disease, it is methimazole, we give it. And it is very safe during the first time PTU, safe during the first trimester. And again, these kind of medications have agranulocytosis, aplastic anemia, because it will decrease the immunity and the cells of your body. Beta blockers, of course, you are going to give it to the patient. Goiter, thyroid storm, and these one, grave disease and hyper, all of them, give the beta blockers. And all the patient antithyroid, we have done the same. Never stop taking it properly. Take at same time sign and symptoms of thyroid. Avoid iodine rich, no aspirin, and look for the sign and symptom of thyroid gland. And what is the treatment? Again, radioactive iodine. Radioactive iodine, I just wanted to tell you further point that radioactive iodine, guys, that it is again not safe for the pregnant nursing women. And same like radioactive organs, that what is happening when you're giving the cancer patient the radiotherapy? Are you commonly visiting those patients? No.
No.
Never. So do tell the same thing, that be by themselves for first 24 hours. If it is a pill, radioactive iodine, even if it is a pill, it is radioactive. And you are being very careful with the urine. Urine, why I'm specifically being peeing and poop? Because even if they are using the toilet in their home, tell them to flush 3 times. 1, 2, 3, and then the radioactivity will be gone. Because radioactive, your urine, your pee, your sweating, your saliva, everything is radioactive. Do not go with the kids and do not meet with your family members for first 24 hours. If you're home, and if you are in the hospital, we will give you the private room with no family, friends, no visitors time. Have to stay in the room. They are not going anywhere else. And because in case if you are working in a as his nurse and the patient is having the urinary catheter, and another thing is, whenever you are dealing with the radioactive thing or the cancer medication which can absorb into your skin, always wear double glove. Double glove means any medication which is very dangerous to your skin, that is what it is. When you're getting, for example, when you're changing this patient and by mistake, you dropped the urine onto the floor, who will take care of that urine? Because urine is having the radioactivity. Now what will happen? Do you think it is you who will touch that urine? No. Housekeeping, they are also human beings. They are not even touching those one. Who is going to touch that one? You are going to call the hazardous team of the hospital. That I have radioactive urine on the floor. Please, teachers, tell us what to do. All right. Your job is done by calling them. Thyroidectomy and educate the post-op care and watch for the respiratory distress for the patient. All right. So this is about the grave disease. And thyroid storm. I just wanted to cover the thyroid storm, life-threatening one. All right, too much increase of your thyroid hormone when you're getting sick or you're having any kind of stress, right? Those kind could be the reason of thyroid storm. And what are the typical sign and symptom? Everything will be so high mean 105 temperature. BP, it can cause the stroke. Tachycardia can cause the VFib. And the mood, it is psychosis, delirium can happen. And thyroid storm is medical emergency. And how are we dealing with high temperature? Give the ice pack, cooling blanket, start the oxygen, monitor the vital signs, and give the cooling blanket. Sedatives, because psychosis, delirium is happening, give the sedative. And strictly no iodine food at all. Got it? And again, antithyroid are the methimazole, PTU, iodine solution, or glucose solution. Fever, do not give the aspirin because it will increase the thyroid problems. And to decrease, give the beta blocker and steroids if it is super high thyroid storms. All right. So overall, hyper and hypothyroidism, these are the sign and symptoms. So please tell me, hypothyroidism, if it is a normal thyroid, everything is hypo, mean low metabolism, they are always cold and everything body will be down, down, down. And if it is an autoimmune disorder, we call it as
Hashimoto
disease. Hashimoto disease. And for hyperthyroidism, everything body will go up and up and up. And autoimmune disorder of hyperthyroidism is
Graves'
Okay.
disease.
grave disease. And in case if it is too much hypothyroidism, too much low, it can cause the myxedema.
Exedema, coma,
And hyperthyroidism, too much high, it can cause
thyroid storm.
And storm.
storm. And that's all. The sign and symptoms is all good. Got it? Any question with hypothyroidism? If you know hypothyroidism, all the 6 problems are solved. You know the sign and symptoms, and the treatment of all or everything is same. It is the name is different. All right, the treatment and sign and symptom, everything is same. So do you have any question for me? Any questions, students? All right, so now let's go for break. And after the break, we'll do a couple of questions and we will start parathyroid. All right. All right, students. Okay, I will see you. It is 5:40. So let's take 20 minutes break. I'll see you at 6 p.m. or 7, 8, 9, whatever is your time. All right.
Okay, thank you.
Thank you.
All right, now let's do a question before we begin with the parathyroid. The nurse is caring for a client recovering from subtotal thyroidectomy. All right, to treat the hyperthyroidism, which finding assessment would require the nurse to immediately notify the doctor. So what is it asking? It is asking that after the thyroidectomy, is it asking you that what is expected or something unexpected happened to the patient that you want to tell the doctor?
Unexpected.
Unexpected.
All right, now let's discuss. Now let me teach you how to do the questions. All right, now from now onward, I will not ask you, but teach you. All right. 0.4 inches, 2.6 centimeter of bright red blood on the surgical dressing site. I'm not learning, I'm not reading all the options, I'm doing one by one. So think about it and tell me, should I call the doctor or not?
It can be.
No.
It can, what?
Maybe.
Maybe. So what?
Maybe.
Because bright red blood here.
All right. So very good. So most of the students, they are worried about the bright red blood. Okay. So now this is not because it can be hemorrhage. This is what you're thinking, everybody. Right? What I am thinking that it is a bright red blood in the surgical site. And what is the size of it? 0.4.
0.4.
4 inches.
I am seeing this much of amount. All right. So is it hemorrhage that I have to tell the doctor?
No.
You guys are seeing that, yes, please call the doctor because it is hemorrhage. Is it hemorrhage?
No.
Is it hemorrhage? You have to check the size. All right, let's see. Client reports sore throat when he's swallowing, while talking and burning when swallowing. When he's swallowing, what is the surgery he had?
Thyroidectomy.
It's expected.
Okay. Some students, because I am like some students, they are not
Expected.
Oh yeah. So some people will think that sore throat, it means infection. What is sore? Sore means pain. Throat means pain in throat. So do you think pain in throat mean infection?
No.
No. If you're having sutures, will you be having pain in throat?
Yes.
Yes.
That is how I'm checking. So this is, I'm not going to call the doctor. Patient is having pain, 8 out of 10. So the patient is having pain after the surgery. So should I call the doctor?
No, it's expected.
That's
No.
expected too.
Expected.
It is expected. Now the temperature is increased to 101 from 98 within 45 minutes.
Yes.
Yes.
Infection.
Infection. Yeah.
Of infection.
All right. So all the temperature is increased mean infection. So Have you heard about thyroid storm, grave disease, whatever I was telling you so far about the thyroid?
Yes.
Yeah.
Yes.
Temperature will be increased in hypertonic.
Thyroid storm. I told you guys that thyroid storm, it is super increase in temperature. So does it always mean that temperature increases mean infection? For everybody, yes. So now you have to assess the thyroidectomy has happened. So do you think it is also linked with the thyroid hormone? So Aman said, no, it is not linked with thyroid. So it is not linked with thyroid. So if you have high thyroid, so what will happen, Aman?
Ma'am, fever increase, like ma'am, temperature increase.
All right. So thyroidectomy means removal,
Yes, ma'am.
but still the temperature is increased. Why it can increase? Who is going to tell?
Because while doing the thyroidectomy, the thyroid gland is manipulated, so the thyroid hormone is released in the body. Maybe that is the reason why the temperature is increased.
Aman, remember that I told you guys when the doctor is doing the surgery, it is like a sponge that when he's touching it, what is happening, Aman? Thyroid will gush into the blood.
blood.
I told you guys in the operation theater itself on the patient, like immediately thyroid storm can happen. Got it? So now
Yes.
tell me, so you are confused between question number, option number 1 and 4. So you tell me, so does this one, does it show hemorrhage? Hemorrhage, what does hemorrhage mean? Uncontrollable bleeding.
Uncontrollable.
So is it uncontrollable bleeding?
No.
So when I have to ask you guys that when, for example, let's imagine that you are doing something in the kitchen and you just had a cut with the knife and you put the band-aid on. Do you see sometimes there is a shadow of your blood on the bandage?
Yes.
Yeah.
Does that mean that you are dying and you are having hemorrhage?
No.
No.
Please have a look because that is what is an issue. Bright red blood, it means there is a hemorrhage. Look how creative NCLEX exam is. Students will be asking, ma'am, 0.1 is the answer. It is a problem in the question because see, they are making me confused. But no, you have to read the full sentence, 0.6. The nurse is teaching a client who has thyroidectomy and has a new prescription of levothyroxine. All right, why there is thyroidectomy mean removal and why the doctor put the levothyroxine on the patient?
Because thyroid is not.
There is no thyroid now removed. All right, immediately after the surgery, there is a gush of blood, but rest of the life, he has to be on thyroid pill. Which of the following information should the nurse include? Means that what are the information you are going to tell the patient? So tell me true or false. Will you tell this to patient or no? Contact your health provider if you experience fluttering or rapid heartbeat while taking this medication.
True.
True.
Yes.
Yes. So
Yes.
first of all, you will think which medication levothyroxine means I'm giving the thyroid pill. If I'm giving thyroid pill, can it increase the heartbeat and medication? Yes,
Yeah.
it will because in case if it is high dose. Drowsiness is common adverse effect of this medication.
No.
False.
Thyroid means everything will go up.
High.
Up.
So do you think drowsiness will happen?
No.
No, false.
You can take this medication with the meal to prevent the stomach upset.
Yes.
No.
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 First of all, thyroid pill, are you taking with meal?
No.
No.
No. Early
So,
morning.
be
Empty
careful.
stomach early morning.
Be careful because most of the medication you are taking with meal, not thyroid pill. You will need to take this medication for the rest of your life.
Yes.
Yes.
Your dose of medication may need to be increased if you get pregnant.
Yes.
Yes.
No one
Yes.
do what
Yes.
pregnancy.
Yes.
test.
Yes.
Very good. All right. Now let's discuss about the parathyroid gland. And how many parathyroid gland we have?
Four.
Four. All right, where it is located in the neck behind the thyroid, and there are total of 4. Now let me tell you that this parathyroid gland, you have to notice that it is related with the calcium. All right, how it is related with the calcium? That, for example, this is PTH, parathyroid hormones, and it is dealing with calcium and phosphate. All right, directly linked with calcium. If the PTH is high, your calcium is high. If your PTH is low, your calcium. All right, and phosphate is opposite. All right, high PTH means low phosphate.
No phosphate.
Low phosphate means low PTH means high
High
phosphate.
phosphate.
But anyways, we need to know about the calcium. All right, so how it is dealing with the calcium in our body? All right, it is not a calcium, it is a hormone. For example, if it is saying that Alveen's calcium is less. All right, so for example, there is a calcium, I have less calcium in my body. So it will give the signal to my brain. So do you think I have anything that will produce more calcium? No. There is no calcium in me, right? So what is happening? My brain will tell PTH that by hook or crook, increase the calcium in Alveen. All right, because her calcium is so low. So what is happening? Parathyroid hormone, how it will increase the calcium? So first of all, where is the calcium located in my body?
Bones.
Bone.
Muscle.
What it will do to the bones to increase the calcium? So when I'm saying Alveen's calcium is low, I am talking about calcemia. Hypocalcemia or hypercalcemia. Hypocalcemia, emia means
In blood.
Blood.
blood. All right. So, for example, if I have low calcium in the blood, my brain will give the signal to the PTH to increase the calcium in the blood. And how it will increase the calcium in the blood? It will act on the bone. So what will happen? It will tell the bone to break the calcium from it and give it to the blood. So what will happen to the bone then if all the calcium is released into the blood?
Weak.
Osteoporosis.
Got it? All right. Another one is PTH. One is bone and then it is kidney. It is telling the kidney to save the calcium. How to save the calcium? Do not excrete it. And then it is going to tell your intestine that whatever Alveen is eating, absorb it. All right? That is how your calcium is increased. Understood? Understood? Now let's say my calcium is very high. It will give the signal to your brain that Alveen's calcium is so high. So it will give the signal to which part?
Kidney.
Kidney.
Thyroid. Why? Remember, thyroid also produce calcitonin.
Calcium.
Remember?
Yes.
Yes.
And calcitonin will decrease the calcium. How it will decrease the calcium? My calcium will be back to bones. Understood? Understood? All right, now let's discuss. All right, so what is happening? That parathyroid hormone, it regulates the calcium and the phosphate, and how? By bones, kidneys, and GI system. All right, and also it regulates the phosphate. Remember, it is opposite of phosphate. It will tell the kidney to release it and to save the calcium. Now, kidneys will do it by reabsorbing the calcium. Bones, it will break by osteoclast. It will break the calcium from it. And small intestine, it will activate the absorption of calcium. Always remember, whenever you are taking calcium orally, and whenever oral calcium, PO calcium, you are taking it from your meals or your pills or anything, calcium always have to attach with vitamin D, and only then it can go to your body. So if you don't have vitamin D, your calcium is not being absorbed. So that is why vitamin D is very important. And this is how the low level calcium and high calcium level, it will give the signal, etc. I told you. And now the sign and symptoms, calcium and phosphate. All right, do you know what calcium do and phosphorus do? All right, so just like potassium will affect heart, sodium will affect the sign and symptoms of
Brain.
neurons, and calcium and phosphate will give the sign and symptoms of
Muscles.
Muscles and
And muscle.
all right.
Bone.
So calcium and phosphate, it helps in calcium plays important role in muscle nerve conduction, bone health, and we always need vitamin D to help the body to absorb the calcium. And the normal is 8 to 10. You don't have to write down the calcium. It is not going to come in your exam. What does calcium do? All right, you please understand. And phosphate, bone health, muscles, nerves, in fact. Harjot, I just see you're writing down. If you're missing, if you keep on writing, you will miss important stuff. All right, easy way to remember. All right. So first of all, this is the calcium and phosphate thing. Please do understand. So for example, if my calcium is low and it is giving the signal, I want my body to increase the calcium. How? Where? It will give the signal to the parathyroid, and parathyroid hormones, it will tell the brains to break the calcium, and then your blood calcium level will be normal. If you have too much high, thyroid gland will do the calcitonin, and then calcium will be normal, and the calcium will go back to the blood. All right. Now, let me tell you one more thing, interesting thing. If you want to know the sign and symptoms, easy way to remember is, all right. So first of all, for example, calcium. I will teach you in my link, in my electrolyte balance, like electrolyte class, that how to remember the sign and symptoms. In order to know the calcium level, right? What is a sign and symptom? You need to know that calcium will do opposite to your body. For example, hypothyroidism, we know it is increasing. Calcium will do opposite to your body. But calcium affects on muscles of the body. All right. For example, if your calcium is low, so what will happen to your body muscle? It will increase. So for example, if I have two things, muscle spasm or muscles are flaccid. Flaccid means relaxed. So you tell me, with high means spasm or flaccid?
Spasm.
Spasm. So tetanus, for example, tetanus. What is tetanus? Mean you are having the muscle spasm. Tetanus is muscle spasm. So muscle spasm mean it is happened because of low calcium. All right. So tetanus, the muscle spasm will happen with the calcium. So when you will see the sign and symptoms, it is opposite, and mostly it is related to the calcium is related with the muscle and nervous system. So now let's discuss the hypo. Hypoparathyroid means calcium will be low and phosphorus will be high. And why there is less production of parathyroid? Either there is a problem, destruction of the parathyroid gland, autoimmune disorder, your body is resistant to parathyroid hormones, and sometimes electrolyte imbalance, especially hypomagnesemia. All right. And parathyroid, remember calcium, it will go same as if it's hypo means low, hyper means high, and phosphate is just opposite. So for example, hypoparathyroidism means calcium is low and phosphorus is high. So let's see the sign and symptom. Sign and symptom of hypo means low calcium. All right, now you will notice the sign and symptoms. Everything will be high with the muscles related. Remember the PTH, parathyroid hormone. P for, first of all, tingling sensation or the mouth, face, fingering tool, paresthesia. Numbness and tingling continuously, you can feel that there is a tingling situation. Positive prosio-antiostic sign, very important. It is a typical sign of hypocalcemia. All right, positive prosio-antiostic sign. Another one is tetanus due to low calcium and high phosphate level. All right, because your muscles is so much spasmodic. Now, what is positive prosio-antiostic sign? It happens when the person is having tetany. All right. So what is happening? Prosio. So prosio, you will remember, it is related to the blood pressure machine. So what is prosio sign? As a nurse, I will put the blood pressure machine onto my patient. All right. And I will inflate the BP machine. And after 3 minutes, let it inflate for 3 minutes. Within the 3 minutes, the patient's muscle, patient's arm will started getting involuntary flex. It will start moving inward. So is it a relaxing or it is a flaccid? Like it is a relaxing or it is a spasm? It is a spasm, means your calcium is low. All right, that is known as prosio sign. Then another is chvostic sign. What is chvostic sign? You can remember CH means chvostic and CH means cheeks. I will touch the cheek of the patient. As I will touch the cheek of the patient, and the patient's lip will start moving to that direction. Like this, if I will touch that one. All right, so that is known as chvostic sign. It is positive. If you will touch it, nothing is happening to us, but hypocalcemia, it will happen. So this is very, very important, chvostic and prosio sign, what it is. And you should know it is related to hypocalcemia. All right, remember that the muscles is increased. So increase mean it is opposite, hypocalcemia is happening. All right, and what is happening with the hypoparathyroidism? Calcium is low and hypophosphatemia. And remember the signs is opposite to the suffix to remember the sign and symptom, as I told you. Prosio is this one and chvostic is this one. All right, once again, hypocalcemia. Remember, it is going opposite to your body, opposite to your muscles, especially. Neuromuscular will be excited. Carpopedal will be spasm. Tetanus, chvostic, prosio. Your body will have seizures, confusion, and EKG will be prolonged QT. And this is a prosio sign. This one, the muscles will be getting twitched. What are you going to do with the patient who is having low parathyroid hormones? How will you treat it?
Calcium rich diet.
Yes, very good. Calcium, right? And what about phosphate? Phosphate, low phosphate diet. Simple thing, right? So now monitor the calcium. First of all, calcium, always monitor the patient with help. If it is low, it can cause the tetanus. Monitor the airway. Why? Because the patient can have tetanus, seizures, etc. And prepare for the worst, right? Ensure the patient is taking high calcium diet and low phosphate diet. Administer the medication, and most common medication we are giving the IV calcium. Of course, the calcium is so low, you will give the calcium. Oral calcium, we don't have time, maybe IV calcium. Calcium means calcium gluconate and any medication with the calcium. All right. Whenever we're giving the IV calcium, it may be very, like it can infiltrate from your veins, and it can be very, very painful. So make sure you are using the central line for that, or the big large vein. Give it slowly, because you remember calcium is also present in your heart. it can cause the cardiac disturbance. All right, and if the patient is on digoxin, it can cause the digoxin toxicity. Or if you are giving oral calcium, not a big deal, you can give, but make sure when you're giving oral calcium, we give it with the vitamin D. Right? Because vitamin D will help in the absorption of calcium. And what will the side effect of calcium? Whenever there is hypercalcemia, the sign and symptoms will be, it is not related to the muscle. Surprisingly, it is related to your constipation, GI upset. And if you have too much calcium in your blood, what will happen? You can have calcium stone. All right, those kind of things can happen. And calcium supplement, remember it always, for example, iron tablet. Remember iron tablet. I hope most of us have taken the iron tablet. And we are giving the iron tablet with which, with what brain?
With
Orange.
vitamin
Vitamin C.
Remember orange juice. Why orange juice? Means it is having
Vitamin C.
vitamin C. All right. Never give iron with calcium. All right. Why? Because calcium will not be absorbed. Give it separately. And what is happening with hypoparathyroidism? What will happen to the phosphate? It is increased. So I will give a medication which will decrease the phosphate. All right. Decrease the phosphate. And surprisingly, the normal medication, actually we use it day-to-day life. It is aluminum carbonate, the Gelocel antacid, the pink solution Gelocel. That one will help if your phosphate is too high. And always make sure you are administering with meals. And of course, hypoparathyroidism, if there is no parathyroid, maybe you can give the artificial parathyroid hormone. All right. Yes, it is available. We call it as NATPara. All right. And if you're giving the artificial parathyroid hormones, always make sure, because the more dose you will give, the patient can have hyperparathyroidism. Got it? So always keep that. So yes, Mehak, what is your question?
Ma'am, if patient have vitamin D deficiency, so patient should take calcium supplement?
Calcium? No. Vitamin D deficiency, take the vitamin D. But for
Okay.
the calcium, we
So-
need vitamin D.
Okay.
Vitamin D can be itself, be gone.
Okay. Thank you, ma'am.
All right. Now let's discuss the hyperparathyroidism. Hyperparathyroidism. Your calcium will
High.
and phosphate will.
Low.
Decrease.
Most common reason for hyperparathyroidism means if you have any kind of cancer. That could be the reason. And the sign and symptoms is related to high calcium. If you have too much calcium in your blood, high calcium means where is the calcium is high? In your blood?
Blood.
So sign and symptom of high calcium is, first of all, what is happening with your bones? Is there any calcium in your bones? If it is all the calcium is in your blood, do you think is there any left in your calcium in your bones?
Weaken bone.
Yes. So bone for fractures, very, very common. Hypercalcemia. Calcium is good in our body if it is on the bones. Calcium in the blood is not doing anything. If you are testing anyone and you are thinking, my God, calcium is so good, it means it is only so good in the blood. It means it is not so good in the bones. So what will happen to your bone health?
Weak.
If too much calcium on your body, so what will happen to your stones? Calcium stones can happen. Common thing, if your mothers, if you have the baby or the child in Canada especially, have you noticed that this, as soon as your kid will start drinking the milk, they will be constipated?
Yes.
Constipation is the number one issue. GI issue, nausea, vomiting, etc. All right. Brain is giving the signal that Alveen's calcium is high. urinate it. Kidney is trying to urinate it, but kidney stones can happen. All right, so those are the things. Hypocalcemia issues, muscles, tetanus, chorostic sign, trousseau sign. But if it is high, it is all linked to the bone fractures, etc. All right, so main reason of high calcium is calcium has left the bones and it is very high in blood sugar, bone fracture, calculi formation, constipation, GI problems, frequent urination and ECG changes can happen. All right, now what is your role? Your calcium is high. Now, how will you decrease the calcium in your blood? How will you decrease the calcium in your blood?
Low calcium.
Thiazide diuretics.
Very good. Diuretics. All right. First of all, thiazide diuretics, it will remove everything but calcium. So you have too much of calcium in your blood. All right. So it will not remove the calcium. It will save it. You want to give the loop diuretics. Why? Because everything will be out. Everything will be out. And if I have stones, then I will give the thiazide diuretics. All right. In case if you have stones, give it to them. But just for the rest of the hypercalcemia, give the loop diuretics. It will remove everything. Monitor ICD, renal stone, calcium, phosphate level, every single thing. Intake and output fluid status, because the patient is risk of developing dehydration of kidney stones.
High fiber diet.
Which diet?
High fiber diet because patient having constipation.
Constipation. Very good. Yes, yes, we can give. Diet low is calcium low diet, high phosphate diet, and definitely I didn't wrote it, but use your common sense, give the high fiber food too. Treatment. Any remember like what we can do? What medication? And remember, it is a hormones. Everything available is available on like artificially.
Calcitonin.
Calcitonin. You will give calcitonin. All right. Got it? And you have the phosphate is low in your body, right? And you're giving the phosphate to the patient. And important, just like thyroid pill is very important, very commonly, not every, but almost second person will get the question on biphosphonate exam. Biphosphonate and alendronate, very important drug. And we will give the teaching to the patient. First of all, let's do the treatment, depends on the cause. If there is a cancer or anything, parathyroidectomy, removal of the parathyroid. And it is the same thing. Parathyroid is also in the neck, every single thing, oxygen, airway, every single thing is there. And in case during the surgery, if the doctor has manipulated laryngeal nerve, the patient can have voice changes, hoarseness, like hoarseness of voice, means the larynx is being damaged. It can happen. Medication is, first of all, normal hydration is very important. Then you are having too much of calcium in your body. And I am giving not calcium, I am giving calcium mimetic. I will giving a something that looks like calcium but is not actual calcium. Because I will give the mimetics of the calcium, my brain will think that Alveen is having too much of calcium, let me stop it for a bit. All right. So that is why, to just make your brain food. Make sure you are giving this with food and right after the meal. Calcitonin, it is injection and nasal spray. Loop diuretic, it will remove everything. Calcium, potassium, everything. And remember, whenever you're giving loop diuretic, don't forget that what is the general sign and symptoms. General sign and symptoms, potassium, sodium, give the same, dehydration, etc. can happen. This one is very, very important, which is biphosphate. All right. This one also known as alendronate. And what does it do? It will help the because what is happening with your bone? Bone are very brittle. It is telling your bone to slow down the osteoclast. Mean don't break the calcium to the blood. I have enough. And you will be having fractures. So alendronate is very, very important drug. Normally, it is very common drug. Whenever you will start working into the field, you will see when, like within your first month, that there is at least one patient with you who is having biphosphonate. And when you're giving, please be careful. I'm so sorry. I ate too much at lunchtime. Sorry. So what is happening? Be careful that Alveen taught you and you've learned that ensure success, that don't rush the patient when you're giving this medication, because I've seen the nurses giving medication all at 8 a.m. Right? This medication is given empty stomach. All right, number one, empty stomach. And what is the thing? First of all, this is empty stomach, not only empty stomach. But the second mandatory step is take it with full glass of water. Thyroid pill, antacid medication, etc. We don't worry about about those things, right? But for this medication, full glass of water. And the third important point is tell the patient to sit up for 30 minutes after taking this medication. And why sit up for 30 minutes and why full glass of water? Because this medication is very hard on esophagus and can cause the ulcers. And in case if the patient is having alendronate, antacid, or thyroid pill, do not give all together. Wait for 30 minutes before taking vitamins or antacid or thyroid pill. Give this medication with full glass of water. Wait. Give thyroid medication, wait, and then give all the medications at that time. So please do this one. I feel so bad for the nurses that who are giving patient is sick, right? He is in hospital, especially thyroid. I told you what is the thyroid is very, very important. And just to save the timing, they are giving all the medication, every single of them all together. So that is not good. So if you are learning something in the classes, I want you guys to use that knowledge when you're actually working on the field. All right. So this is it for today's, and tomorrow we will discuss Addison, Cushing disease, and I have really good ways how to easy to remember. For example, SIADH, DI we did discuss today, DI decreased, ADH, super increased ADH, soaked inside, dry inside, like metabolism is high with the thyroidism, parathyroid is all about the calcium. All right. So do you have any question for me? Do you have any question for me? All right. Okay, I know it is like only 6:40, but this is all we have today. Are you there behind the camera? Alveen, Makide, Samina, Rajiv, Ruby, Shweta, Navri. So how was class? Did you understand?
Yes.
Yes, ma'am.
Okay. All right.
Yes.
So, all right, I will see you all tomorrow then. All right. So we will try to finish the endocrinology, and then we, if possible, we will start GI system. But I'm trying to add more questions so that I can start, you know, like, so that I can teach you guys some skills, because this is an issue. And don't worry if your scores are less, because as soon as we are done with the syllabus, I will take over with the strategies class, and believe me, you will learn a lot of strategies when I will teach you this. All right.
Yes.
Thank
All
you.
right.
Thank you, ma'am. Good night.
Bye.
So
Thank you, Dee. Bye.
Bye-bye.